Every bariatric surgery program that I know of has a strong prohibition against alcohol intake around the time of bariatric surgery. Most often this prohibition begins in the run-up to bariatric surgery and then extends for many months after the surgery is complete. Here at Sage Bariatric, our recommendation is to suspend alcohol intake completely for the first full year after the operation is done. Why is this? What are the cautionary concerns about alcohol intake? And I would say there are two concerns. The bigger one, and the one that's going to take up most of the information and the time in this video, is a concern about a slight but real increase in the rate of alcohol consumption, the rate of alcohol addiction or alcoholism after bariatric surgery. That's number one. And then number two, there's concern about regular use of alcohol after surgery definitely leads to weight regain. Now, the weight regain concern is actually a little bit easier to discuss, so I'm going to mention that quickly and then set it aside and get to the main meat of our topic. The concern with weight regain after bariatric surgery is that alcohol itself is a calorie source. The processing of alcohol, which is not sugar despite what you hear in some places, but the processing of alcohol involves conversion to calories that are used as fuel, and that's fat that you don't burn or it's fat that you store. The second concern about alcohol and weight gain is that when you've got a little intoxication, either minor or major, you tend to make decisions that are not so good, and you tend to nibble food, snack food, and eat junk food very often. So people that have regular consumption of alcohol after bariatric surgery are at very high risk of weight regain in the long run. Okay. Let's move back to this concern about alcohol addiction after bariatric surgery. The way we're going to work through this is first we're going to talk about what is observed in terms of alcohol intake after bariatric surgery, its effect on all patients and its effects that might lead to alcohol addiction. And then we're going to talk about the current best scientific understanding about why these changes occur and how they might lead to a small chance of addiction. And then we'll talk about perhaps some practical ideas about moving back into enjoyable social alcohol use with caution. Very early in bariatric surgery history, it was observed that patients were very sensitive to alcohol. Surgeons would jokingly tell their patients that they were going to become a cheap date or a lightweight. And research has shown that this effect of being sober to completely intoxicated in just a little bit of time and a little bit of alcohol is part of the addictive profile of alcohol I'll come back to in a minute. But when we talk about who is most susceptible to alcohol addiction after bariatric surgery, research has given us a couple of characteristics of differences in percentages. And so if a person has regular alcohol intake before their bariatric surgery, that is a risk factor. If they have a smoking history before surgery, that is a risk factor. If they're male versus female, that's a risk factor. As I already mentioned, gastric bypass is a little bit more of a risk than sleeve, although sleeve patients do also seem to be at risk, so we need to pay attention to this all the way around. And one interesting note, in most of the research projects, the risk of alcohol addiction didn't show up until 2+ years after the surgery. So in one very good study, the overall risk of high-risk drinking behavior before surgery was 7.6%. And this is an important point. So we're not talking about alcohol addiction with 0 before surgery. There are some people that have problems with alcohol, technically called alcohol use disorder. Some people that have this before surgery. So in this very good quality research study, 7.6% of patients prior to surgery had some alcohol use concerns or alcohol addiction potential or real alcohol addiction. The rate was 7.3% at 1 year after surgery, which is down slightly, and then 9.6% at 2 years. And then it was stable beyond that. And it's also interesting to note that the group of people with alcohol use problems before surgery weren't exactly the same group that had alcohol use problems after surgery. There were some people that had problems before surgery that stopped alcohol, and some people who had no problems with alcohol before surgery who picked it up. So despite these risk factors that I just mentioned, there's not one uniform process, and really everybody ought to be pretty cautious with it. In a similar research study looking at a different group of patients, there was a 2% rate of alcohol use problems prior to surgery and a 5% at 2+ years beyond the bariatric surgery. So pretty similar numbers, talking about a 2 or 3% increase in the rate of alcohol use disorder or alcohol addiction after bariatric surgery. Now, there are two pretty interesting research studies that start to give us a crossover from what is observed with alcohol intake after bariatric surgery and start to point to a significant degree into why this is happening before I get into deep physiology. So let me review these two research studies. One of them was done in 2011. The other was a fresh study that was just done here in 2022. In both of these studies, bariatric surgical patients were tested before they had surgery as a baseline and then tested against themselves, or they were tested again at 1 year after their bariatric operation, and the results were compared with each other. So these are patients who are compared against themselves in kind of a standardized alcohol intake manner. In both of these research studies, there was a single calibrated drink that was taken in. So in the 2011 study, that tested the effectiveness of one drink, as I mentioned, and the one drink resulted in the postoperative patients having a 4 times higher peak alcohol concentration that arrived a lot faster and actually took longer to clear in the patients who had had bariatric surgery. The 2022 research study was very similar in the sense that, again, they used one calibrated drink. Again, the patients were compared against themselves when they were tested before surgery. And in a similar way, the peak alcohol concentration was higher than it had been in those same people before the surgery, and it arrived dramatically sooner. And in this study, they actually measured the timing, and the time to peak alcohol for postoperative patients was 7 minutes, but it was 43 minutes in pre-op patients. So that's like a huge difference. And this is going to come back in a little bit to the physiology piece that we're going to talk about. They also did a little bit of psychological testing in the 2022 study and asked people how they felt with their buzz or their intoxication after they had had the one drink. And they found that the reward findings on the psychology testing were higher with the intoxication level after the bariatric surgery than they had been before the surgery. And this might seem intuitively obvious. I mean, if you're more drunk, you feel better, but that's not always true. But it turned out to be true in this particular set of patients. And so that also, in some way, seems to point towards more of an addictive or attachment profile. The authors did theorize in their setting from observing their patients and talking to their patients that the rapid onset was part of the more addictive profile of the alcohol intake after bariatric surgery. Let's jump from there into the physiology of bariatric surgery and alcohol, because there is something physical that's happening that's making bariatric surgery patients more susceptible to alcohol, that makes them have higher alcohol peak levels that happen faster and are more difficult to control, that make bariatric surgery patients a cheap date. It's physiology. And to understand this bariatric surgery / alcohol physiology, first we're going to talk about the physiology of alcohol processing in a non-operated intestinal tract with the normal stomach and the normal small intestine. And the first thing to understand is that when you drink alcohol with a non-surgical stomach, that alcohol stays in the stomach for an extended period of time, and there is very limited absorption from the stomach itself. And in fact, there's an enzyme in the wall of the stomach called alcohol dehydrogenase that begins to break down the alcohol before it ever leaves the stomach. This is called first pass processing, and this is factor number 1. That means that alcohol peak levels are lower and alcohol peak levels have a slower onset in non-surgical patients with a normal stomach, because the stomach holds on to it and has minimal absorption, and the stomach processes it. Number 2, the stomach allows contents, whether it be food or fluid, to exit the stomach only gradually through this valve at the bottom of the stomach that's called the pylorus. And so the alcohol, along with other fluid contents and food contents, only gets to the small intestine in a gradual way, more gradual in a normal stomach with a pylorus than in a surgical stomach with the gastric bypass or with the small capacity of the sleeve. And that's important because the small intestine, this is factor number 2, the small intestine absorbs alcohol very rapidly. And so when you pretty much have alcohol go in and it only gradually trickles out, then there's only a gradual absorption of the alcohol into the bloodstream. Even though it's absorbed more or less immediately, it doesn't get to the small intestine very quickly. Now, number 3, when nutrients and food and toxins and alcohol are absorbed from the small intestine, they go into the portal venous system and to the liver first. And the liver is the main place that alcohol is processed. And so the liver gets a shot at the alcohol. As it passes through that portal vein, the liver has its own alcohol dehydrogenase, which will, to a significant additional degree, detoxify the alcohol before it gets to the rest of the system. There's another thing, especially with overweight people, is that the liver has a strong buffering system against alcohol, and that is the glycogen, and the fatty stores in the liver actually to a certain degree soak up or detoxify the alcohol. So once again, in non-surgical, non-bariatric GI anatomy, there are at least 3 factors, we can break them down different ways, that moderate the intake of alcohol. Number 1, the alcohol is held in the stomach with minimal absorption. Number 2, the alcohol is broken down actually in the stomach. Number 3, the alcohol only gets absorbed gradually because it only gets to the small intestine gradually. And number 3, the liver itself is a bit more robust. Even if it's not totally healthy from a fatty liver, it's a bit more robust in the context of alcohol because of the fatty liver and the glycogen stores in the liver. And so most people have the experience of not having to pay a lot of attention to how they drink, not on a minute-by-minute basis for sure. And it's not too hard to find that kind of warm, fuzzy, pleasant glow, mild intoxication level of alcohol with a normal non-bariatric stomach. And it's going to be very different, as we'll discuss coming up in just a second. Now we're going to use gastric bypass as our example of how things can be different after bariatric surgery, although as I said, the sleeve is also showing up as a situation where people can have higher peak levels of alcohol, higher onset, and they can have a higher percentage of alcohol addiction after surgery as well. But let's talk about gastric bypass. So in gastric bypass, the alcohol/fluid will enter the little stomach and more or less immediately, because it's fluid, will more or less immediately go into the small intestine. And so 2 things are not happening right there. One thing is that there is not any significant stomach processing of the alcohol. This first pass metabolism, this alcohol dehydrogenase, does not have time to act, and the little stomach is so small that basically the level of alcohol that's swallowed all becomes available to the small intestine, and then factor number 2, it becomes available to the intestine very quickly. So almost immediately when you swallow alcohol after your gastric bypass, it's going into your bloodstream, at least within a few minutes, as that research study showed with the 7-minute peak. The third thing that happens, and again, when it's absorbed into the small intestine, the alcohol passes first through the liver, and now something is different in the liver because through the massive weight loss, which is a great thing overall, the liver's glycogen and fatty stores are depleted, so there's less of a buffer or less substance in the liver to soak up the alcohol. The other thing that happens is that the liver's alcohol dehydrogenase is still intact after weight loss and after gastric bypass and after bariatric surgery, but that system only works at, let's say, 5 miles per hour. It can only go at 5 miles per hour. And so if the alcohol hits it so much more quickly after gastric bypass, if it hits it at 50 miles an hour after the gastric bypass because it's being absorbed so rapidly, then 45 units of that alcohol are going to the system and to the brain, versus if the alcohol is absorbed more gradually back to the normal stomach situation at 10 miles an hour, then only 5 units of the alcohol are getting past the liver and past that processing into the bloodstream. Okay, so the physiology after bariatric surgery, more or less immediately when you swallow, it gets absorbed, goes into the bloodstream, exceeds the liver's capacity to process it immediately, and it goes straight to your head. Lightweight, cheap date right there. Hey, now I almost forgot to mention one really obvious physiology change that happens that makes people more sensitive to alcohol, and that is the weight loss itself. I mean, if you lose 100 pounds, give or take, you're going to have less volume of distribution to take care of whatever alcohol you consume, no matter how quickly it's processed. Now, on a separate subject, there's a theory of alcohol addiction that I'm going to mention to set it aside, and that is the theory of addiction exchange. There's the theory that when people can't eat in the way that they used to, and this comes from a theory of being addicted to food, which I'm also not sure is really a thing very often. But anyway, the idea is that you can't eat food, so you drink alcohol instead. And I would not say that the available research has disproven that theory, but I will say that the available research does not show any support for that theory. So that's not going to be a big part of what we're going to talk about. Let's move from there into how one might cautiously and appropriately get back to alcohol in the appropriate time interval after their bariatric operation. After all, many people have alcohol as an appropriate, well-controlled social aspect of their life. And whereas there is a concern about alcohol addiction and alcohol misuse after surgery, most people don't experience that. And I think that we can reduce that percentage of addiction if we teach people how to handle it and how to use it carefully. So what are the general principles for getting gradually, safely, cautiously back to alcohol use in a way that's neither going to predispose to addiction nor predispose to weight gain? And before we talk about how to drink alcohol safely after bariatric surgery, I want to be clear and transparent and say that there's not any health benefit at all to drinking alcohol after bariatric surgery. This is strictly for pleasure, whether you feel it adds accent to food or whether it's in certain social circumstances. And I think those things are okay. I drink alcohol myself in limited amounts, hopefully on rare occasions. But I want to make it clear that it's a treat, it's an exception, it is not the optimal health plan, and there is not any physiologic need for alcohol for anyone at any time. Okay, so having said that, I recommend that you wait until your weight trajectory is as low as it's going to be and then actually rebounds just a little bit, because we talked about these factors where the liver wants to have some buffering capacity. That's a little bit of healthy glycogen, a little bit of natural fat in the liver, and just a little bit of energy back in your body. I think the other thing about waiting for this time period for your weight to reach its nadir and maybe up just a tad, not that we want weight regain, but people rebound a little bit. The reason for waiting until that point is that that's a time that you've got your other habits all in line and you're less likely to be disrupted by any adverse influence that alcohol may have. So wait for a long time. Like I said, at SAGE, our guideline is for a year. I think you can have different guidelines, but you really do need to wait for a long time. Number two, I think that your first experiment with alcohol ought to be done in a very well-controlled setting, in private, at your home, with trusted individuals, whether that be a spouse or a couple of friends. And these individuals all need to know that you are conducting an experiment so they can help you know if you go off track, and also so that they can monitor you and then let you know 3 months down the road if you happen to be one of the unfortunate people who get stuck with alcohol addiction. They can help you pull out of that and help you recognize it before it gets to be too severe. So protected environment. Number three, I think that you should have one drink, whether it be one glass of wine, one highball, etc. Keep it on the low sugar side. Of course, we're always going low carb, and so you don't want to go for the pina colada, the strawberry daiquiri, but you know, a dry white wine or a red wine or a highball that doesn't have sugar soda in it, those would be choices that would be acceptable for this. One drink I really recommend, and then the last clear recommendation is to make that take at least 30 minutes by the clock, because once again, unlike pre-bariatric surgery, where your body gradually controlled the pace of absorption of the alcohol, right now you're going to have to control the pace at which it enters your bloodstream by how quickly you swallow it. Okay, so just assume that pretty much as quickly as you swallow this, it's going to hit your head. You just need to be very slow and gradual, and that's a tricky balance, because if you get a little buzz, you're not going to pay attention. So that's why I recommend the one drink, use the clock, 30 minutes, and all those things. So I hope that will be useful to you. And when you're drinking alcohol, I recommend that you do eat some food with your alcohol. I know this is not what you're supposed to do. You're supposed to separate your fluids and your food, but remember, I said the alcohol is a treat. And the idea about having some food with your alcohol is that that's going to be another buffer situation. That's going to be another way of gradually slowing the exit of the alcohol from your little stomach into the intestine, and actually will slow absorption. So multiple exceptions to the rule. Like I said, this is social, this is a treat. Now let me change gears. If you're watching this video because you are someone who is concerned that you may already have an alcohol addiction problem, or if loved ones around you have expressed that you have an alcohol addiction problem, you probably do. And I'm sorry to say that, but if you're concerned, then it probably is a problem. And the good news on that is that there are a lot of resources now, developing resources to help you with that. And I recommend that you reach out to your bariatric team, raise this concern with them, and they should have good plans to be able to help you a lot with that concern. But now in closing, I hope through better understanding and information, I've given everyone some understanding about why we want to be cautious with alcohol around bariatric surgery, increased motivation to be very cautious with alcohol around bariatric surgery, and then, if you choose, how to use it carefully and appropriately. Best of luck on your journey.